Hello guys, I am Dr. Vishnu and today we are going to come up with a long presentation which will be divided into individual short videos. So I request all of you who are interested in our mission and who have subscribed to our channel to please stay tuned. You will keep getting updates regarding the remaining parts of this video daily. Because since the title suggests that drug of choice for microbial infections, there are so many microbial infections. And if I start covering all of them in a single video, it will take a long duration of time. But at the same time, there are so many interesting things that we don't know about microbial infections, the drug of choice, and obviously about the individual antimicrobials. So when we are covering all of them, definitely it will take time. So this presentation has been divided into individual segments, and every day in the morning you will get the individual parts which you can follow. So welcome to an ocean of practical knowledge. So this is regarding a special disclaimer. It is just a very brief concept about choice of antimicrobials and how they vary depending on clinical scenarios. Drug of choice for selected organisms or infections. So this is what we are going to cover in individual parts of the video. Please note that the presentation is divided into individual parts. So do stay tuned to our YouTube channel for further updates in successive days. And please do share this with other people as well, because as we know, the mission of our channel is books are available everywhere. Notes are available everywhere. There are students who are clearing exams. There are students who are getting good amount of marks. PowerPoints are available everywhere. But the problem that we commonly face is whatever we are studying theoretically, how much we are able to retain it, how much we are able to remember it is a very big challenge. And definitely this field is very big, and it is a field that has no end, because there are so many new informations that keep coming daily regarding some or the other disease or some or the other medicine, not only in India but all over the world. So our mission is to interpret theoretical knowledge that you are getting from standard books into a practical perspective that you can visualize even if you are not getting hospital exposure. So for example, if I'm talking about anti-cancer medications, and even if you are not having an oncology posting, you can get a lot of information about practical aspects of anti-cancer medicines through this channel. So this YouTube channel or this lecture series is applicable to all those who are working in their profession in the hospital, who are students or interns, or who are working in a tertiary care hospital, and even those who are not getting proper hospital exposure also. For them also, this presentation is worthwhile. So please remember that all of you are working hard, but that is only for your academic requirements. We have to work smart, which will definitely boost our memory and it will propagate our career fulfillments. Welcome to an ocean of practical knowledge. So when I'm going to talk about the drug of choice for selected infections, that actually can vary from particular scenarios to scenarios. So the drug of choice may vary depending on culture report analysis. The drug of choice may vary depending on clinician or healthcare professional choice. And it also may vary depending on the risk versus benefit ratio. So for example, if I say that for a particular microorganism, the drug of choice is particular antibiotic, it is not necessary that the same antibiotic will be used everywhere. So that may depend on the experience of the healthcare professional in dealing with some other antibiotic, which is much more safe and much more efficacious. It also may depend on the individual comorbidities of the patient. So maybe some antibiotics may be safe, some antibiotics may not safe. So we have to switch over. So a lot of things are there. We will talk about that in individual slides. Culture report analysis. This is very important. Like recently, I was just referring a particular book, and I found that the drug of choice for E. coli is ceftriaxone. Ceftriaxone can be given for E. coli infections. But definitely, if you are in a clinical scenario, or if you are working in the antimicrobial stewardship department, or if you are working, or if you have seen such kind of cases in which the urine analysis or the blood culture of the patient shows E. coli, but that E. coli is resistant to ceftriaxone as per the culture report. But here we have said that the drug of choice is ceftriaxone, but that ceftriaxone, even if it is the drug of choice, it is resistant. So in that condition, what will we do? So then, according to the culture report, we have to select a particular antimicrobial which is sensitive for that organism. And based on that, we have to change the therapy. So please remember that whatever we are studying in the books, it is always not necessary to get applied in individual conditions. So we have to look at this is actually a topic called individualization of patient regimen. I hope you will study this in 5th year. If you are a PharmD student and you are watching this, then definitely in your 5th year PharmD, there is a subject called Clinical Pharmacokinetics and Therapeutic Drug Monitoring. In that, there is a topic that comes individualization of patient regimen. So the concept of that chapter means that we are saying a lot of things about guidelines, but when it comes to an individual patient, we may have to alter the therapy based on the individual patient's condition. So in some conditions, the drug of choice might be a particular antibiotic, but it can be resistant to. So in that conditions, we may have to switch over to another antimicrobial. So I've just given an example here. Maybe for Candida infection. Candida is actually a fungus. So fluconazole is considered to be the drug of choice for Candida infections. But if the culture report shows that Candida is resistant to fluconazole, so there we cannot use that antifungal because it is resistant. So in that condition, we may have to switch over to any other antifungal which is active against Candida. So for example, maybe you have to give Anidula fungin, maybe you have to give Mica fungin, etc. So the drug of choice is just a general concept. Based on the patient's condition, we have to adjust. And definitely clinician or the healthcare professional choice is very important, because there are clinicians who are dealing with a particular antimicrobial for a selected condition, and they have been using that for a long time with good amount of success. So definitely they will carry on with a particular antimicrobial, considering that it is having the least side effects and having better efficacy. So in such scenarios, definitely clinical pharmacists and physicians do collaborate together in selecting a particular antimicrobial for a particular infection. So this usually happens in foreign countries. So a clinical pharmacist usually collaborates with clinicians. It happens in Indian scenarios also. So based on that, the proper antimicrobial is selected, whether it is an empiric therapy, whether it is a prophylactic therapy, or whether it is a definitive or targeted therapy. Anyways, in future slides, I will be talking about rational use of antibiotics and what are the guidelines. So I'll talk about that later. So there you will understand what I mean by these terms. So the rationality of antimicrobial choice depends on antimicrobial stewardship guidelines, which is usually created in each healthcare institution. They have their own set of guidelines for empiric, targeted, and prophylactic therapy. So clinical pharmacists, microbiologists, and physicians contribute together to ensure a successful antimicrobial stewardship program in a clinical setting. Because the microbiologist also has a good role to play, because the microbiologist receives the samples from the patient and then they analyze those samples and then they create a report based on the sensitivity, whether an organism is found, and if an organism is found, what is its sensitivity and what is its resistance pattern. So the microbiology also has a very important role to play. And the last is risk versus benefit ratio. See, whenever we study about medicines, whenever we study about conditions, you may have come across many medicines which are said to be contraindicated in some conditions. But it doesn't mean that we completely cannot use it. So if that condition of the patient is very dangerous and only that drug can save the patient, but at the same time the drug is contraindicated because of some other side effect, we have to first save the life of the patient. So there we may have to use the medication even though it is contraindicated. So in certain situations, the choice of antimicrobial may be X, but it may be contraindicated. That means it may not be good to be used in a patient. In such conditions, we may have to look for better alternatives. Like for example, if we want to use aminoglycosides for a particular infection and the patient is having severe kidney dysfunction. So we know very well that aminoglycosides usually cause nephrotoxicity. So if we find that there are some other antibiotic which can be used in that particular infection and it has nothing to do with nephrotoxicity, then we may switch over to that particular antibiotic instead of aminoglycosides. And it can happen vice versa also. For example, a patient is having a very severe infection and the blood culture is showing that the patient is having a particular infection. For example, Acinetobacter baumannii, which is very common nowadays. And all the antimicrobials are resistant, only colistin. Colistin is a polypeptide antibiotic. Colistin is only sensitive. But the patient is also suffering from kidney problem. And colistin usually, polypeptide antibiotics usually have a problem. They cause nephrotoxicity. Polymyxin B, colistin, etc. They usually cause nephrotoxicity. But there the patient is suffering from sepsis or septic shock, which is much more life-threatening. So there we don't have any other choice because all the other antimicrobials are resistant. So we have to save the life of the patient. So we start with colistin. At the same time, we will keep on monitoring the patient's renal function parameters to see whether the renal function is becoming worse or not. So this is called risk versus benefit ratio. So we have to, so this is what we usually say, that it is all depending on the real life scenario, what is happening with the patient, and then we decide which is the best antimicrobial that can be used in a particular patient. So now we come to individual antimicrobials and infections, and we will talk about what are the drug of choice for an infection, or if a particular antimicrobial is being mentioned, in which all conditions it is the drug of choice. So carbapenems are drug of choice for, DOC means drug of choice. Carbapenems are drug of choice for Acinetobacter baumannii, ESBL producing organisms. So ESBL is also known as extended spectrum beta lactamase. So in the name itself, you can understand beta lactamase is an enzyme which is produced by the resistant organism and it breaks down the beta lactam ring. So extended spectrum means this particular enzyme will break down a variety of beta lactam antibiotics. So nowadays, according to guidelines, if a particular organism is producing ESBL, then the drug of choice is usually carbapenem. So we usually go for meropenem. We can give imipenem also, but in the case of imipenem, we have to make sure that we give it along with cilastatin, because imipenem is usually broken down by renal dehydropeptidase, which is an enzyme produced by the brush border cells of the kidney. So if imipenem is broken down by that enzyme, then definitely it will not be able to show its antimicrobial efficacy. So that is why cilastatin is a molecule that is added along with imipenem. But meropenem is a good choice as well. And please remember, there is another medicine called ertapenem. Ertapenem is actually a carbapenem. The problem of ertapenem is that it is longest acting. Actually, it is a very long acting carbapenem, but it is ineffective against Pseudomonas. So if you are having a Pseudomonas infection, we should not use ertapenem. Then there is an organism called Serratia marcescens also it is known as. So against Serratia also we can use carbapenems, and definitely against Enterobacter also we can use carbapenems. But again, as I said, it all depends on the culture report and what is the status of the culture report. Penicillin-G, which is a natural penicillin, it is the drug of choice for actinomycosis. So it is an infection which is caused by Actinomyces israeli. So for that we can give penicillin-G. Anthrax. Anyways, anthrax is not a very common disease, but still in sporadic areas it is still to be found. So it is caused by Bacillus anthracis. Gas gangrene. So we have usually 3 types of gangrene. We have dry gangrene, wet gangrene, and gas gangrene. So it is almost a kind of irreversible cell injury, and it is very severe also because it can lead to amputation of a particular organ or a particular tissue. So gas gangrene, if an infection is caused by gas gangrene, that is Clostridium perfringens, then the drug of choice is penicillin. In conditions of leptospirosis, it is known as Leptospira interrogans. So in that condition also, we can give penicillin. There is a condition called rat bite fever. From the name itself, you can understand it is spread by rodents. It is caused by Streptobacillus moniliformis. In that condition also, we can give penicillin-G. In Streptococcus infections also, penicillin-G can be given, but nowadays there are resistant strains of Streptococcus. So again, as I said before, don't just jump into conclusions. What all the things that are mentioned here are practical perspectives, but when we get a culture report of the patient, on the basis of what the report says, we have to switch over to individual antimicrobials. Syphilis. So it is for a long time. In syphilis, it's a sexually transmitted disease, which is caused by Treponema pallidum. So in that condition also, penicillin-G is the drug of choice. And there is a condition called Yaws disease. It is caused by a subspecies of Treponema. It's known as Treponema pallidum subspecies pertenui. In that condition also, penicillin-G is the drug of choice. Now, when we come to some amoebial infections, so we have to first understand what kind of amoebial infection it is. If it is an extra-intestinal or intestinal infection and the patient is having symptoms of that infection, in that condition, the drug of choice is metronidazole. That is why in many gastrointestinal surgeries, even in diabetic foot infections, urological conditions, and many conditions, we usually give metronidazole, because metronidazole has a capacity of being effective against anaerobic organisms also. So if the patient is having extra-intestinal or intestinal amoebial infections and the patient is having symptoms, then metronidazole is the drug of choice. If the patient is having only intestinal infection and the patient is asymptomatic, then we can go for paromomycin. Paromomycin is actually a very newer aminoglycoside. And if you have seen my video on aminoglycosides, I have said about this. This is a very special aminoglycoside because it is the only drug in that particular class which is effective against worm infections. All the other aminoglycosides are antibacterial in nature, but paromomycin has efficacy against worm infections. Voriconazole is a drug of choice. So voriconazole, from the name itself, you can understand it is an antifungal. It comes with fluconazole, itraconazole, etc., etc. So voriconazole is a drug of choice for Aspergillus infection, Scedosporium, and Trichosporon. So these are actually 3 types of fungus. So if these fungal infections are happening in your body, voriconazole is considered to be the drug of choice. Metronidazole. This is a very, very popular antimicrobial. It is an antibiotic and also has anthelmintic activity. So metronidazole is the drug of choice for amoebiasis. So just now that I said before, if you are having extra-intestinal or intestinal amoebiasis and it is symptomatic as well, then we can give metronidazole. Bacterial vaginosis. So this usually happens in females, and somewhere due to some kind of bacterial colonization or improper hygiene in these conditions also, this can happen, this infection can happen. So this is usually caused by Gardnerella vaginalis. So that is the organism which is more notorious for causing this. So in this condition also we can give metronidazole. Bacteroids infection. Bacteroids is actually an anaerobic organism. So against this infection also, so if any infection is caused by bacteroids, we can give metronidazole. For tetanus also, metronidazole has shown to be efficacious, but definitely metronidazole alone is not given. You have to consider other antimicrobials also, because tetanus is obviously a very devastating disease. Trichomoniasis. So this is usually caused by Trichomonas. So in an infection like trichomoniasis also, we can give metronidazole. And giardiasis. So in this condition also, the drug of choice is metronidazole. Now we come to the last part of this part 1 video, and that is doxycycline. So doxycycline is the drug of choice for Borrelia infections, Brucella infections, so in combination with rifampin. So if you are having brucellosis, which is caused by Brucella, so along with rifampin, you know very well, it is used for tuberculosis also. So doxycycline in combination with rifampin is given for brucellosis. Bartonella infection also we give doxycycline. Doxycycline, you know, it's a tetracycline. It is a broad spectrum antimicrobial. For chlamydial infections also, because chlamydial infections are very common, especially chlamydial infections have been found in immunocompromised patients also. So if the patient is suffering from HIV or any kind of condition where the immunity is very poor, chlamydial infections are commonly seen. In cholera also, doxycycline may be given. Granuloma inguinale. So in this condition also, doxycycline is the drug of choice. Lymphogranuloma venereum. In this condition also, doxycycline is the drug of choice. Mycoplasma hominis associated infection. So in this condition also, doxycycline can be given. Inflammatory acne. You know very well what acne is. So in this condition also, we may give doxycycline. Actually, we have other antimicrobials also. But in severe cases of inflammatory acne, so this is usually caused by Propionibacter. So in this condition also, doxycycline can be given. Rickettsial infection also, we can give doxycycline. And then there is a condition called pleurodesis and pericardiodesis. So in this condition, actually, these are some procedures. These are actually procedural methods. So here also, doxycycline can be given. So doxycycline is the drug of choice for all these selected conditions, which you can see in the presentation. So that's all for this part 1 video. In the next part, we will talk about other individual infections or other individual antimicrobials and against which organism they show activity or they are drug of choice for. So you can note it down also. You can download this video or you can just note it down. And definitely, as I said before, whatever things that have been mentioned here, this may vary depending on the patient's condition, depending on the healthcare professional's clinical choice, and also depending on risk versus benefit ratio. So considering all of this, we come to a term which is known as antimicrobial stewardship. And based on proper guidelines, we usually follow the individual antimicrobials. So thank you so much for listening to this part 1. We will have a lot of individual parts for this large session. which will come to you daily. If you have any comments or if you have any queries, or if you want to know something more regarding this, then please feel free to contact us in our Instagram channel and also in our Telegram page. We will be happy to serve you. Please remember that practical knowledge is very important, especially in a condition where many students are not getting proper hospital exposure or not getting proper guidance. This kind of presentations may help you in bringing your skills to a different good level. So thank you so much for listening. See you in the next video. Till then, bye.